Finals SAQ17 Intra Aortic Balloon Pump. A. What is meant by counter pulsation in the context of an intra aortic balloon pump? Counter pulsation refers to inflation of the balloon in diastole and deflation of the balloon in early systole. B. Briefly explain the effect of counter pulsation from an Iabp on coronary blood flow and the left ventricle. During inflation of the balloon, this forces blood proximally, which increases pressure within the proximal aorta versus the left ventricle. This increases perfusion of coronary arteries and delivery of oxygen to the myocardium. Inflation of the balloon also forces blood distally, increasing apparent cardiac output from the left ventricle. Inflation of the balloon augments Windkessel effect. Deflation of the balloon reduces afterload, thus reducing myocardial wall stress during systole, and this reduces myocardial oxygen demand. C. What are the indications for and contraindications to the use of an intra-aortic balloon pump in an adult? Indications include cardiogenic shock, for example, due to myocardial infarction if revascularization is planned, acute mitral regurgitation or ventricular septal defect due to acute myocardial infarction, refractory ventricular arrhythmias while awaiting definitive treatment, refractory unstable angina if treatment option available, refractory left ventricular failure if destination treatment is planned, and for perioperative support for high-risk coronary artery bypass surgery and for high-risk non-cardiac surgery. Absolute contraindications include aortic regurgitation, aortic dissection, aortic stent, chronic end-stage heart disease with no further possible intervention. Relative contraindications include uncontrolled sepsis, abdominal aortic aneurysm, severe peripheral vascular disease or arterial reconstruction surgery, uncontrolled bleeding disorder, and tachyarrhythmias. D. List possible complications of an intra-aortic balloon pump. Complications include hemodynamic compromise due to poor timing of counter pulsation or malposition, ischemia of the limb, spinal cord or viscera such as kidneys, compartment syndrome, aortic dissection, vascular injury causing bleeding, hematoma, false aneurysm or arteriovenous fistula, cardiac tamponade, thromboembolism, thrombocytopenia, hemolysis, infection, and gas embolus due to balloon rupture.